So, good day, everyone. So, for our first online discussion, we will be talking about enzymes. So, for our learning objectives, so at the end of this lesson, so you should be able to determine accurately the concentration of the clinically significant enzymes in the sample, identify the possible errors that can affect the analyte measurement, interpret the results by comparing to the reference range, and demonstrate appropriately the proper specimen preparation. So what are enzymes? So enzymes are proteins produced by living cells that enhances chemical reaction in organic matter. Okay? They are biological catalysts that play an important part in metabolism by increasing the rate of chemical reaction. So they are measured in terms of their activity and not in terms of their absolute values. They are large molecules and they are normally confined within cells unless increased membrane permeability allows them to enter the blood. They also frequently appear in the serum right after cellular injury, degradation of cells, or from storage areas. So, abnormal large amounts of enzymes in serums are used clinically as evidence of organ damage. So, enzymes are large protein molecules, all of which have their own specific 3D shape. So embedded within the shape is a region known as the active site. So this one. So which can attract other suitably shaped molecules to bind to the site. So the analogy that is often used to describe this mechanism is that of a key fitting into a lock. So the enzyme serves as the lock and the attracted molecule called the substrate is the key. Okay, so lock and key mechanism. So we have the IUB classification. IUB stands for International Union of Biochemistry. Okay. So to standardize enzyme nomenclature, the Enzyme Commission adopted a classification system in 1961 and then revised the standards in 1972 and 1978. So enzymes are classified according to their biochemical functions, indicating substrate and class of reaction catalyzed, and are designed by individual identification numbers. So they are assigned four-digit numbers. So no, the first digit in those four places the enzyme in its classification. So ito yon. We have six classifications. Number one, oxidoreductases. So they catalyze an oxidation reduction reaction between two substrates. Next is transferases, catalyzes the transfer of a group other than hydrogen from one substrate to another. Number three, hydrolases. This one catalyzes hydrolysis of various bonds. Number four, lyases. So catalyze removal of group from substrates without hydrolysis. So the product contains double bonds. Isomerases naman catalyze the interconvention of geometric optical or positional isomers. And then lastly, ligases. So catalyze the joining of two substrate molecules coupled with breaking of the pyrophosphate bond in adenosine triphosphate or similar compound. Okay, so the first digit in those four assigned numbers is either of this, so 1 to 6. Okay? So the second and third digit naman represents the subclass to which the enzyme is assigned, and then the fourth digit is a serial number specific to each enzyme. Okay, so for example, these are the major enzymes of clinical significance. Okay, so for example, CK, creatinine kinase. So EC enzyme formation, tapos ang number assigned sa kanya is 2732. So 2, ang kanyang first digit, meaning, balikan natin yung 2, it is a transferase. So it is a kind of transferase. And then 7 and 3 is the subclass, and number 2 is the serial number specific to CK. So ganun po siya. Okay? So you don't have to memorize din naman ito, just be familiar na lang. Okay? So major enzymes, ito ulit yon. So ito yung mga clinical significance ng mga enzymes. So we have acid phosphatase or ACT. Okay? It is significant for prostatic carcinoma. We have ALT, hepatic disorder, aldolase, skeletal muscle disorder. Okay, alkaline phosphatase, that is hepatic disorder and bone disorder. Amylase, acute pancreatitis, and so on. Okay, so for this one, be familiar with this. And also, kunyari ito, acid phosphatase, ang kanyang abbreviation is ACT. You should memorize yung mga abbreviation nila. Okay, kasi mas madalas or all of the time talaga, ganyan sila isinusulat. Sa mga request form, sa laboratory, hindi isinusulat yung buong pangalan nila. Okay, yung abbreviation talaga. So you should know them by their abbreviation. So again, basahin nyo na lang to and familiarize yourself. So self-explanatory naman na siya. Okay? Next, we have enzyme reactions. Okay, so we have two kinds of enzyme reactions. So we have zero order reaction. So this one is the reaction rate that depends only on enzyme concentration. And then number 2 is the first order reaction. So ito naman, reaction rate is directly proportional to substrate concentration. So to measure the extent of enzymatic reactions, there are two general methods used. Okay, we have the endpoint and the kinetic. Pag endpoint, so this is the type of reaction which combines reactants and then stops the reaction at a fixed time, for example, 20 minutes, and then measures the product form. So activity of the enzyme is based on the final absorbance reading. For endpoint or fixed time, time sensitive siya. Pag sinabing na dapat within 20 minutes, you should read the final result na 20 minutes talaga. Pag more than that, hindi na magiging accurate yung resulta ninyo. So for endpoint, ang reaction nito is continuous. Okay? So, if sinabing 20 minutes, kunyari, 20 minutes lang talaga. Para hindi, or para maging accurate yung magiging reading. Okay? For kinetic naman or continuous monitoring, so this type of reaction combines reactants, then measures the change in absorbance at specific time intervals over a specific time period. So activity of the enzyme is based on the change in absorbance over time. So for kinetic naman, hindi lang once nire-read yung inyong absorbance. Or pag sinabing absorbance, di ba, i-translate to parang mismong result mo. Okay? Okay, doon mo nakukuha yung result. So for kinetic, hindi lang once siya i-read. So i-read mo siya ng paulit-ulit over a specific period of time. Then you will get your result by yung change in absorbance over time. Okay? Okay. So again, for endpoint, so reading and the final, i-read mo siya at a fixed time. Okay? Sa kinetic naman, i-read mo siya in multiple times at a specific interval. Okay? Okay. So we have different units for expressing enzymatic activity. Number 1, we have international unit. This is 1 micromole of substrate per minute. And we have the Catal unit. Ito naman ay 1 mole of substrate per second. So enzymes are quantified based on their activity, rather than absolute values. So the units used to report enzyme levels are activity units, and it must consider the change in pH, substrate, and other factors. So enzymes are measured in terms of their change in substrate concentration, change in the product concentration, and change in coenzyme concentration. So what are the causes of increased serum enzyme levels? Number one, we have impaired removal of enzyme from plasma. Number two is tissue necrosis and degeneration. Number three, increased permeability of cell membrane. And number four, increase in the number of cells or the production of cells. Okay? So let's move on to different kinds of enzymes. So ito yung mga major clinically significant. Number one, we have creatinine kinase. Ang abbreviation niya is CK or CPK. Okay? So systematic name, creatinine N-phosphotransferase. So clinically significant siya for MI, myocardial infarction, or skeletal muscle disorders, specifically Duchenne disorder. Okay? Ang function niya is for ATP regeneration. Yan, ito yung kanyang reaction catalyze. Okay? For the enzymes, papasadahan lang natin to, okay? Kasi mas specific ang discussion nito sa lecture part. Okay? For the reference range, this one is according to Bishop 7th edition. So males is 46 to 107 unit per liter, females is 34 to 145 units per liter. Yeah. So CK isoenzymes. So we have three isoenzymes for CK. We have CKBB, CKMB, and CKMM. For the CKBB, it is most specific for the brain. Pero makikita rin siya sa bladder, lungs, uterus, colon, stomach, and thyroid. Okay? Pero most specific siya sa brain. CKMB most specific for the heart, and CKMM for the skeletal muscle. So, ito yung different assay methods that we use to detect CK or creatinine kinase. We can use electrophoresis. Next, we have Tanzer-Gilbert assay. This is a forward or direct method. It uses the pH of 9.0 and 340 nanometer ang kanyang wavelength. Next, we have Oliver-Rosalsky. This is the reverse or indirect method, which is the most commonly used method for CK analysis. It uses a pH of 6.8 and 340 nanometer din siya. So, lactate dehydrogenase. Okay? So, lactate dehydrogenase, ang shortcut naman niya or abbreviation is LDH. Systematic name, L-lactate, NAD plus oxidoreductase. Clinical significance niya is also for myocardial infarction, liver disorder, hemolysis, can be also found in megaloblastic anemia and mga cancers. Function niya is hydrogen transfer. Its reference range is 125 to 220 unit per liter. So we have different LDH isoenzymes. We have LD1, LD2, 3, 4, 5. So 5 isoenzymes. Okay. So for LD1, okay, so most specifically sa heart siya makikita. Same as with LD2. Okay, so sa heart and sa heart. So kung mapapansin niyo yung mga enzymes na makikita sa heart, if elevated sila, they can probably mean myocardial infarction or parang heart attack. Okay? Kasi again, why do enzymes increase? One reason could be tissue damage. Okay? So nare-release sila from the tissues kaya sila napupunta sa blood. Okay? Yeah. We have LD3, which is found in lungs, lymphocytes, spleen, and pancreas. LD4 is found in the liver. LD5 is found in the skeletal muscle. So for the total LDH or total LDH in the blood, so ito yung kanilang percentage ng mga isoenzymes. So we have different assays that we can use. First is the Walker method. This is the forward or direct method. It uses a pH of 8.8 at 340 nanometer, which is the most commonly used method for LDH assays. Next, we have Robles-Kila-Du. Yung reverse naman utilizes 7.2 pH. We have two other methods, which is the Robles-Kila-Kabald and Berger-Broida. Okay. So, pronounced elevation, kapag 5 times more ang LDH in the blood, okay, it could mean widespread carcinoma, okay, hepatitis, megaloblastic anemia, systemic shock, and hypoxia or renal infarction. Kapag 3 to 5 times naman ang elevation, it could mean myocardial infarction, pulmonary infarction, hemolytic conditions, leukemias, muscular dystrophy. Pag slight elevation naman, 3 times or less lang, it could mean liver diseases, nephrotic syndrome, hypothyroidism, and cholangitis. Next, let's move on to transferases or transaminases. So we have two kinds, aspartate aminotransferase and alanine aminotransferase. Okay? For aspartate aminotransferase or AST, other name niya is serum glutamic oxaloacetic transaminase or SGOT. Sa ALT naman, other name is serum glutamic pyruvic transaminase SGPT. Okay, so wag pagpapalitin yung dalawa. Okay? Before, nalilito din ako sa AST kung ano yung kapartner niya, SGOT ba or SGPT. So, ang ginawa kong palatandaan, AST, yung S may curve, same as with the O. Okay? Pabilog din siya. Yun. Yun. So, yun yung ginamit ko kaya para matandaan ko siya. If you wanna use it, then go. Share ko lang. Okay? Yeah. So let's discuss first AST, aspartate aminotransferase, AST or SGOT. Okay. So clinical significance for this is MI or liver disorder or skeletal muscle disorder. Its function is for the synthesis and degradation of amino acids in intermediary metabolism. So for the reference range, that is 5 to 35 unit per liter. So for AST, it is widely distributed in tissues. Okay? So major tissue niya is liver, cardiac tissue, and skeletal muscle. Other sources naman is kidney, pancreas, and RBC. So we use Karman method for its detection. It utilizes a pH of 7.5 at 340 nanometer. So let's compare it with ALT or SGPT, alanine aminotransferase. So systematic name L-alanine, oxaloglutarate aminotransferase. Clinical significance for this one is liver disorder. So this one is much more specific for liver disorder compared with the SGOT. So ang major tissue niya is liver, although makikita rin siya sa kidney, pancreas, and RBC, heart, skeletal muscles, and lungs, but elevation and SGPT, number one, pwede nating i-relate sa liver agad. Unlike with the SGOT, medyo malawak pa yung coverage niya. So we have different assay methods for ALT. We can use the Rietmann-Frankel. This is a colorimetric method. And then coupled enzymatic, which utilizes a pH of 7.5 at 340 nanometer. So we have a concept called the Ritis ratio or the Ritis quotient. So this is the ratio of AST and ALT. Okay, so AST Uh, yeah. So we use this to compare or to know if yung cause ba ng hepatitis is viral or non-viral. So if the Deritis ratio is mas mataas si AST compared with the ALT, non-viral ang cause ng hepatitis. Pagbaliktad naman, mas mataas si ALT kaysa kay AST, viral hepatitis ang cause ng hepatitis. So it is viral. For alcoholic hepatitis naman, we can know din siya. Ang ratio ng alcoholic hepatitis is 3:4:1. Okay? So 3:4 ang AST is to 1 ALT. Okay, that's for alcoholic hepatitis. So let's proceed with phosphatases. So we have two kinds of phosphatase. Then we have alkaline phosphatase and acid phosphatase. So alkaline phosphatase, abbreviation niya is ALP. Clinical significance niya is for bone disorders and liver disorders. Its function is it liberates inorganic phosphate from an organic phosphate ester. For its reference range, so okay, 4 to 15 years old, it is 54 to 369 units per liter, and then different din, nagbe-base tayo sa gender and sa age din ng patient. Okay, so be familiar with this one. So we have different isoenzymes for ALT. So we have liver, liver, bone, intestine, and placental isoenzymes, and we also have Regan and Nagao. Okay, so Regan and Nagao are carcinoplacental ALP. Carcinoplacental ALP. Okay, so Regan ALP is found in lung, breast, ovarian, and gynecologic cancers. Bone ALP, co-migrator, and ayun. Okay. Nagao ALP naman is found in adenocarcinoma of the pancreas and bile duct, pleural cancer, and a variant of Regan ALP. Okay, so these are their performance under different tests. So we have for order of anodal migration sa electrophoresis to, under electrophoresis. So the most anodal we have the liver, next is bone, and then the placental, and then the intestine. Again, this is for electrophoresis. Okay? So phenylalanine, this is under chemical inhibition test. Okay. So under this chemical, so 10% ang nai-inhibit for liver, 10% for bone, 75% inhibited sa intestine, and so on. Okay? For the heat naman, this is the heat fractionation test. Okay, so most heat labile, okay, si bone isoenzyme. Most heat stable naman is the placental. Okay, so this one, placental and the Regan and Nagao. Okay, so under the placental is Regan and Nagao. Again, Regan and Nagao is carcinoplacental. So yun. So ALP assay methods, again, nabanggit na, we have electrophoresis. This one improves the separation of bone and liver, ALP. Okay, so most anodal again si liver, followed by the bone, and then placental, and then intestine. For the chemical inhibition test, phenylalanine, under phenylalanine, it inhibits the placental and intestinal ALP. 3-M-urea inhibits the bone ALP, and the levamisole reagent inhibits bone and liver ALP. So heat fractionation test, so most heat stable again si placental, and most heat labile is si bone ALP. We have other methods. Firstly, we have Bowers and Macomb. So this one is the most specific method for ALP. It utilizes a pH of 10 and under 405 nanometer wavelength. So we have other assays. So we have Radansky, Shinawara, Jones, Reinhardt, King and Armstrong, Bessie, Lowry and Brock, Huggins and Talalay, Moss, Klein and Babson, and Reed. So this is a summary of ALP methods. These are the substrate used and their end products. Okay. So I guess take a screenshot of this na lang and read it at your own time since this is very much self-explanatory. So be familiar with this one. Okay, so babasahin nyo lang din naman siya. Okay? So next, let's proceed with acid phosphatase. Okay, so acid phosphatase, its abbreviation is AECP. Systematic name, orthophosphoric monoester phosphohydrolase, almost same with the ALP. Acid nga lang siya. Acidic environment lang. Clinical significance niya is, it is most specific for prostate carcinomas. Okay, reference range is 0 to 3.5 nanogram per ml. So again, major tissue na is a prostate, though it can also be found sa erythrocytes, sa platelets, bone, liver, and spleen. Okay, so possible sources of error is hemolysis. If hemolysis sample, it can cause false increased acid phosphatase kasi nga meron siyang or present siya in erythrocytes or RBCs. Okay, kapag hindi niya siya properly stored, it loses its activity in 1 to 2 hours at room temperature. So we have different assays that we use in ACP. We can use immunochemical method. Okay, so we can use RIA, counter-immunoelectrophoresis, immunoprecipitation, and immunoenzymatic assay. So enzymatic methods naman, same as ALP, but acidic environment lang ang ginagamit natin. So pH is 5. So same with the ALP. So familiarize yourself na lang din to. So this is a summary of acid phosphatase methods. In spectro, okay, same with ALP pala, spectro din po yung gamit dun. So these are the substrate and their end products. So gamma-glutamyl transferase. Okay, so gamma-glutamyl transferase, its short name is GGT or GGTP. Clinical significance for liver disorders. Okay, function is peptide and protein synthesis, regulation of tissue glutathione levels, and transport of amino acids across cell membranes. So it can also be found in the proximal renal tubule, in the liver, in the pancreas, and in the intestines. It is used as a marker for occult alcoholism. Okay. So for GGT, we use a enzymatic method which produces a yellow color, yung p-nitroaniline. So it utilizes a pH of 8.2 at under 405 wavelength. Next we have is the amylase. Its short name is AMY or AMS. So that is amylase. So this one is clinical significance niya is for acute pancreatitis. So its function is catalyzes the breakdown of starch and glycogen. So its isoenzymes is P and S. So P stands for pancreatic amylase and S stands for salivary amylase. Okay, so amylase, it can be found in your saliva. So these are the different assay methods. So we have sacharogenic, which is our reference method. This one measures appearance of the product. Measures the amount of reducing sugars produced by the hydrolysis of starch by the usual glucose method, and measures the disappearance of starch sorry. So aminoplastic measures the disappearance of starch substrate and decrease in substrate concentration. For chromogenic naman, it measures the increase in color intensity, and coupled enzymatic is continuous monitoring of the test. For coupled enzymatic, it utilizes a pH of 6.9 under 340 wavelength. We can also use electrophoresis and inhibition test. Inhibition test so that we can know or we can identify yung specific amylase concentration. Okay, so salivary amylase equals total amylase minus the pancreatic amylase. So salivary amylase is inhibited by the wheat germ lectin. And we can also use monoclonal antibody. Next one we have lipase. Lipase is also for acute pancreatitis. So function is catalyzes the partial hydrolysis of dietary triglycerides. Reference range is less than 38 units per liter. Okay, so the major tissue where lipase can be found is the pancreas. So this one is much more specific for acute pancreatitis. So 6 hours after onset of attack, nag-i-increase na siya, and then they peak at 24 hours and remains elevated for 7 days. So different assays, we use Cherry-Crandall. Cherry-Crandall is the reference method for lipase detection. It uses a substrate of 50% olive oil or triolane. You can also use the turbidimetric method, also uses olive oil. Okay, so decrease in turbidity equals increase in lipase. Colorimetric method, okay, we can also use peroxidase and glycerol kinase. So glucose 6-phosphate dehydrogenase, G6PD or G6PDH. Okay, this one is clinically significant in drug-induced hemolytic anemia. Its function is NADPH production in the pentose phosphate shunt and can also be used as a newborn screening marker. It is found in the adrenal cortex, spleen, RBC, and lymph nodes. So deficiency of G6PD can lead to drug-induced hemolytic anemia after taking primaquine and anti-malarial drugs. Elevation naman ng G6PD may mean myocardial infarction or megaloblastic anemia. Its reference range is 7.9 to 16.3 unit per gram of hemoglobin. For the reference ranges, be familiar sa lahat ng reference ranges, ha? So, enzymatic method ang ginagamit natin for G6PD analysis. So, red cell hemolyzate is used for the detection. So, serum is used for evaluation of enzyme elevations. So, we have other enzymes. You can found yung much more detail nito in your handouts, which is also posted in the Google Classroom. So for aldolase, sorry. Okay. Aldolase is seen in glucose, fructose, fructose metabolism. It has three isoenzymes. We have aldolase A, which is found in skeletal muscles, aldolase B, found in WBC, liver and kidneys, aldolase C, found in brain tissues. We have 5-nucleotidase. This one is a phosphoric monoester hydrolase, predominantly secreted from the liver. So elevated 5-nucleotidase can be seen in hepatobiliary disease. So this one is the second marker for obstructive jaundice. Next, we have leucine aminopeptidase or LAP, increased in hepatobiliary diseases. We have ornithine carbamyl transferase, which is unique to the liver, and isocitrate dehydrogenase. So they elevate in hepatobiliary and hepatocellular injury. Next, we have angiotensin converting enzyme. So converts angiotensin 1 to angiotensin 2 within the lungs. So they function as a blood pressure regulator. They can be found in the lungs, testes, macrophage, and epithelioid cells. So elevated angiotensin converting enzyme can be a diagnostic tool for sarcoidosis. Trypsin seen elevated in acute pancreatitis, chymotrypsin and elastase 1 in chronic pancreatic insufficiency naman. Lastly, we have macroenzymes. So macroenzymes can happen for CK, amylase, and so on. Amylase, ASCT, ALT, AST, GGT, LDH, and lipase. Okay, so they happen if those enzymes are bound to immunoglobulin, which is microenzyme type 1, or a immunoglobulin substance, microenzyme type 2 naman yun. Okay. So macroenzymes are important to detect because they causes difficulty in the interpretation of diagnostic enzyme results and also cause false elevation in plasma enzymes. Okay, so we use electrophoresis and other immunologic tests to detect macro enzymes. Okay. So that's it for our discussion for enzymes. So yeah, if you have any questions, just ask your respective instructors, or you can also message me. Okay, so thank you for listening and good day.